Good to see Dr. Hussain in person after I was out a couple of Wednesdays.
Yes,
so
good to see you, Tim.
Yeah, glad to have you here. And a lot to talk about. I know we've been talking about pneumonia cases, a lot of children going to hospitals, especially in China and across the globe. Looks like there's some pneumonia coming from something called mycoplasma, which I hadn't heard of before. But I think the important thing here, it's not new, correct?
That is correct.
Right.
It's been around for a very, very long time, Tim. Every few years, we see an uptick in mycoplasma-related pneumonia. We're seeing it now. This in the U.S., we're seeing it in Ohio in a specific county, so it's not widespread yet.
Right.
But to your point, China and certain places in Europe are seeing an increase. We probably saw more cases pre-pandemic of mycoplasma. It usually impacts school-age children, 5 to 12-year-olds. It can cause what is known as walking pneumonia.
Right.
So fever, cough, malaise, fatigue, those type of symptoms. And so it's important that your child gets checked out, seen by a pediatrician. And there is a different type of antibiotic that is used for mycoplasma, not the regular set of antibiotics. So something to keep in mind.
But this is a rise that comes and goes on its own, maybe every 2-3 years. Okay, so that's just something to keep in mind.
We don't have a novel virus or any sort of pathogen that is causing this uptick so far, as we know.
That is the important thing here. All right, moving on. Eli Lilly, the drug maker, just announced that its flagship weight loss medication, Zepbound, is now available for people to use just for chronic weight management. I guess before it was just used for type 2 diabetes. So that seems like good news.
Yes, absolutely. So it joins Ozempic and Wegovy. These are blockbuster drugs that are already available to lose weight. FDA gave approval to this particular medication, Zepbound, last month. It's now commercially available by Eli Lilly, Tim.
Yeah.
And it's FDA approved for this indication. And so who needs to raise their hand or speak to their provider is adults who have a BMI of more than 30. They're considered obese. If you're overweight, that's BMI of more than 70. Or if you have any weight-related medical conditions that can be impacted by taking this drug, such as high blood pressure, diabetes, cardiovascular disease, those folks should have a discussion with their provider.
Okay. The final topic I wanted to get your thing on, and this seems like it needs more time than we can give it. Starting to see companies that are offering, I guess we'll say intravenous therapies, IV therapies, but not as treatment for a disease necessarily, but almost as like a nutritional supplement. They're saying, hey, you can feel younger, you can look younger, you can get the vitamins that you might be missing from your diet. Some of them say it can help with a hangover. You come in, they'll put a needle in your arm and you'll feel better after that. Of course, people use IV treatments in hospitals all the time, so it seems like it could make sense. But what do we know and what do we not know about these and how well?
Yeah, great question. There are more and more of these mushrooming across the country, across the globe, actually, Tim. So it's important you have a discussion with your provider to see, would you really benefit? Yeah. The scientific evidence behind all these hydration bars or clinics is a little flimsy, to be honest, Tim. There are two buckets that how I see this. One is on the hospital side, where patients who definitely need IV medication, IV hydration because of their underlying condition, whether they're dehydrated or they need antibiotics or whatever medication they need through an IV, is warranted. But on the other side, there's the non-medical, all these wellness clinics where someone may not really have a deficiency of vitamins, and would they really benefit from vitamin therapy, IV therapy, for instance. So the evidence for things like that is a little, flimsy.
Is it a way to get vitamins? I know sometimes you can get supplements that you take where there's huge amounts of vitamins, but that doesn't mean your body absorbs it all.
I would say yes, but there are other ways that are more healthier, that are more mainstream, such as, having a balanced diet that would lend to you getting whatever, the nutritional needs are of your body.
And that doesn't require going to a place and having them put an IV and a needle in your arm in order to get it.
Right. But now, if you do have a deficiency, though, if you have pernicious anemia, for instance, and you need vitamin B12, that's different. So if you have an underlying medical condition that necessitates you getting IV therapy, that's a different story. But if you're well, if you're out and about and you just want to get an IV stuck in you, I'm not too sure about that.
Not too sure. So we'll see, and maybe we'll get more studies that tell us what it can and cannot do. Dr. Hussain, thank you so much for taking the time to join us again.
Sure.
From Trinity Health of New England, as always, Erica, a good fountain of knowledge for us.
Absolutely.